Well, a new DEA rule is creating some confusion for EMS agencies around Maine over who can supply and store controlled substances like fentanyl and ketamine.
Now some departments are taking on new responsibilities and expenses to make sure paramedics have the medications they need. CBS 13's Max Williams is live in the studio now with the impact this change is having on first responders, Max.
Well, Katie and Greg, this DEA rule is actually nearly a decade old, but its implementation was delayed due to COVID. Now that it's officially in place, there is a cost factor for EMS agencies, something that's catching the attention of Maine's congressional delegation, which is worried it could put a strain on rural agencies.
When you need to be rushed to the hospital, life-saving medication is often at paramedics' fingertips.
We gave 272 controlled substances dosage last year.
Lieutenant Ben Guild, who oversees EMS for South Portland Fire, says controlled substances like ketamine or fentanyl are most commonly used for pain relief. For years, those medications were supplied by hospitals. That was before the rule change.
We're maintaining it, we're keeping account of it, and the hospitals are kind of out of the play, if you will. They're out of question.
Confusion is now building from a new 2017 DEA rule, placing emphasis on EMS agencies registering with the agency and handling their own controlled substances. The DEA, however, says the registration is not a requirement and does not replace any previous compliant arrangements to provide patient care and emergency services to the public.
It allows us, the department, to purchase our medications how we want them.
The conflicting interpretations have put stress of making sure they are fully stocked with meds on EMS agencies like South Portland.
Same thing with the room itself. There's a key code that
A secured, roughly $20,000 controlled substance vending machine is now the newest addition to the department.
This is going to ambulance 43, and then it opens up, and then it allows you to withdraw. This is the narcotics kit itself. So here's our fentanyl, our Versed, and our ketamine.
It may look easy now, but Lieutenant Guild says getting here took time.
This, unfortunately, has been a lot of my life for the last few months.
And some extra money in medication expenses.
And I can see how a smaller service may have some challenges with this because they may not have the funds that we do.
Those concerns have now reached Maine's congressional delegation. In a letter to the DEA, lawmakers say the current confusion is creating what they call a crippling operational and financial burden for EMS agencies and are urging the agency to issue clarifying guidance.
And we did reach out to DEA for a comment today, but we did not hear back. Katie.
All right, Max. And what is the biggest concern for smaller EMS agencies if hospitals continue not supplying critical medication?
Yeah, Katie, well, it all comes down to having enough funding, but it's not paying for the medication itself that's the problem. Before the ruling, hospitals would charge EMS agencies for the medicine anyway, but now agencies will have to buy medication storage units, which can run up to $20,000, like we saw in South Portland, something smaller rural agencies may not be able to afford. Maintaining those storage units also takes time, which may pose a challenge for volunteer fire departments, Katie.
We'll keep following this story, Max. Thank you.